Our National Society is justifiably proud to claim a historic connection to Army nursing through our first Librarian General, Dr. Anita Newcomb McGee, who practiced medicine here in Washington, D.C. and directed the DAR Hospital Corps during the Spanish-American War. In 1902, she was serving as acting Assistant Surgeon General for the United States when she founded the Army Nurse Corps. More than a century later, the Army Nurse Corps includes more than 20,000 medical professionals, one of whom is honored with the annual Dr. Anita Newcomb McGee Award as Outstanding Army Nurse of the Year. Our National Society presents this award to an individual who has demonstrated expert clinical practice, effective leadership, and commitment to advancing the science of nursing. In so doing, we honor the memory of our early DAR member who founded the storied Army Nurse Corps. Tonight, we salute Lieutenant Colonel Christopher Stucky. Dr. Stucky, a visionary nurse scientist in the Army Nurse Corps who has been widely recognized for his program of research, executive leadership, and volunteer service to specialty nursing organizations throughout a military career that spans 3 decades. Lieutenant Colonel Stucky serves in several senior nursing roles, including Army Director of the Biobehavioral Research Interest Group, Board of Trustees at the CCI Research Foundation, and as a perioperative consultant to the Army Surgeon General. His research, leadership, and advocacy advance military nursing science and improve clinical outcomes. Lieutenant Colonel Stucky is a prolific researcher and author, having published 28 peer-reviewed manuscripts. He presented at 25 medical conferences around the world, winning the 2021 and 2022 Army Nurse Corps Association Nursing Research Awards. As a leader, he has been a major contributor to revising military nursing protocols for safety and for patient care. He is also an excellent mentor to his fellow nurses, working to reduce barriers to learning and increasing the number of certified nurses. On behalf of the National Society, it is an honor to present Lieutenant Colonel Christopher Stucky with the 2022 Dr. Anita Newcomb McGee Award. Thank you so much. We'll put your comments there. Perfect. You're very welcome.
Good evening, and thank you, Madam President General, for the kind words and warm introduction. I'm honored to be selected as the recipient of the prestigious Dr. Anita Newcomb McGee Award as the Army Nurse of the Year, and I'm delighted to join you on National Defense Night to honor our active duty service members and veterans. Military nursing has a storied and revered past, with military nurses providing life-saving care for the sick and wounded in response to virtually every U.S. military conflict since the country's inception. Loyally serving humankind in war and peace, military nurses train and prepare to quickly deploy to operations requiring healthcare support to victims of combat trauma, disaster, and disease worldwide. The multi-talented skill set of military nurses was on full display during COVID-19, where they managed crises and developed clinical solutions to provide safe, quality health care to our service members and beneficiaries. They continue to bolster staffing in civilian hospitals strained by pandemic surges across multiple states. Military nurses in my current location, Landstuhl Regional Medical Center in Germany, were at the forefront of humanitarian missions, Operation Allies Refuge and Operation Allies Welcome, where they supported the healthcare needs of Afghan evacuees and injured U.S. service members. Our Army Nurse Corps motto is to embrace the past, engage the present, and envision the future. While the Army Nurse Corps has a long and distinguished lineage, our past is intertwined with the great history of the Daughters of the American Revolution. When embracing the history of the Army Nurse Corps, it is important to discuss our beginnings and our esteemed founder. The Army Nurse Corps was founded by a brilliant visionary leader and member of the Daughters of the American Revolution, Dr. Anita Newcomb McGee. She founded and directed the DAR Hospital Corps to train volunteer nurses during the Spanish-American War, and in her role as acting Assistant Surgeon General, established the Army Nurse Corps in 1902. The Army Nurse Corps is the living legacy of this trailblazing pioneer, and we owe a debt of gratitude to the DAR and to Dr. McGee for our important beginnings. It is an honor and a privilege to serve our nation's warriors and their families as an Army Nurse Corps officer. Service to others has provided me with a profoundly rewarding and enriching career, whether caring for patients as a perioperative nurse or contributing to Army medicine as a nurse scientist. Our robust military nurse scientist community is engaged in life-saving medical research to improve healthcare quality and safety for all those entrusted with our care and to improve warfighter readiness on the battlefield. Our nurse scientists are pioneering advances in combat casualty care, surgical safety, women's health, resuscitative care, biobehavioral research, and many other areas. I am proud to be part of this important scientific community leading healthcare innovation within military medicine. Thank you for this recognition. I accept this award on behalf of my fellow Army Nurse Corps officers, past and present, my family, including my wonderful wife, Michelle, who's down here in the front row in the red dress. Say hi to her if you see her. And I'd also like to thank the many great leaders who have mentored me and supported me throughout my career. I'm grateful for your time and for the opportunity to speak to you. I'm proud to serve. God bless America.
You are out of central casting. Perfect.
Thank you.
Well done, sir. Thank you so much.
Sure.
Congratulations, Christopher.